Diabetes, also called diabetes mellitus, a group of diseases that result in too much sugar in the blood, high blood glucose. There are three main types of diabetes: type 1, type 2, and gestational diabetes. Type 2 diabetes, also called adult onset diabetes, a chronic condition that affects the way the body processes blood sugar, glucose. With type 2 diabetes, the body either doesn't produce enough insulin or it resists insulin. Very common. More than 10 million cases per year, India treatable by a medical professional. Requires a medical diagnosis. Type 1 diabetes, also called juvenile diabetes, a chronic condition in which the pancreas produces little or no insulin. It typically appears in adolescence. Common. More than 1 million cases per year, India treatment can help, but this condition can't be cured. Requires a medical diagnosis. Lab tests or imaging always required. Prediabetes, also called impaired glucose tolerance, a condition in which blood sugar is high but not high enough to be type 2 diabetes. Without intervention, it's likely to become type 2 diabetes within 10 years. Very common. More than 10 million cases per year, India treatable by a medical professional. Requires a medical diagnosis. Lab tests or imaging always required. Symptom often, there are no symptoms. When symptoms do occur, they include excessive thirst or urination, fatigue, weight loss or blurred vision. Treatment's progression from prediabetes to type 2 diabetes isn't inevitable. With lifestyle changes, weight loss and medication, it's possible to bring a blood sugar level back to normal. Losing weight. Eating fewer refined carbohydrates and fats and more fiber. Reducing portion sizes. Eating out less often. Spending at least 1 hour every day in physical activity. The difference between the type 1 and type 2 diabetes is that type 1 diabetes is a genetic condition that often shows up early in life, and type 2 is mainly lifestyle related and develops over time. Causes of type 1 diabetes. It is a type of autoimmune disease. Most of the time it is genetic or certain environmental element. Type 1 diabetes, the immune system of the body attacks the insulin-producing cells in the pancreas. As a result, the body is no longer able to produce insulin. Type 1 diabetes is often hereditary and is first seen in childhood and adolescence. It can also occur in adulthood over the age of 40. Causes of type 2 diabetes. In type 2 diabetes, your body usually becomes resistant to the insulin that is being produced. The pancreas produces insulin but the body is not able to use it effectively. The risk factors for type 2 diabetes are age, family history, lifestyle, and obesity. The good thing about type 2 diabetes is that with timely diagnosis, right treatment, and positive lifestyle changes, it can be put into remission.